Hello, everybody. My name is Damla. I am a dietetic intern and a grad student in Texas Women's University, and I've been a food service intern in Medical City Denton, and today I will talk to you about vegetarian menus. But before that, our mission and patient promise. Above all else, I am committed to the care and improvement of human life, and I am committed to excellence always, every action, every patient, every time. And I can start by defining vegetarianism. It is the practice of abstaining from the consumption of one or more types of foods from animal origin, especially flesh. According to our academy, if vegetarian diets are appropriately planned and they are nutritionally balanced, they're considered healthful, they're adequate, they're definitely appropriate for all stages of life, they have many health benefits. Um, and they may even help with the prevention and treatment of certain diseases. So, why do people choose to be vegetarian? They may have many reasons. This could be religious reasons, ethical reasons. Some people are not happy with the idea of killing animals. Some people have environmental reasons because plant based diets are more environmentally friendly. Some people think plant based diets and vegetarian and vegan diets are simply more healthy compared to diets with lots of meat. And some people simply don't like meats or animal products. They don't like to eat them. Um, and we have many types of vegetarians. Lots of names here, so I will define all of these one by one. But let's start with the most common one, which is ovo-lacto vegetarian. So ovo-lacto vegetarians will be the people that you meet most commonly under the category of vegetarians. A lot of vegetarian patients fall under this category, and our vegetarian menu in Medical City Denton is designed to designed to provide an ovo-lacto vegetarian menu. So in this type of vegetarian diets, dairy products and eggs are okay, but meat, fish, or shellfish are avoided. So if they're eating only dairy, if they're consuming only dairy but no eggs, then we call them lacto-vegetarian. And if they're consuming only eggs but not dairy, then we call them ovo-vegetarian. And vegans, you definitely may have heard about vegans. They avoid all animal products. But not only that, they also avoid animal byproducts and food ingredients that are animal based. And the and they also avoid the foods processed with animal ingredients, which is a lot of foods. And they avoid honey, vinegar, wine, and beer. And sometimes they exclude even animal products and clothing, medication, and even personal care products. And pescatarians, they are okay with eating fish and or seafood, but they don't eat red meat or white meat. Um, and they are considered vegetarians who are eating dairy and eggs. So basically, if a person is eating fish, dairy, eggs, but not white and red meats, then we call them pescatarian. And flexitarians are, they usually follow a predominantly vegetarian diet, but they eat meat here and there. So they could be eating meat once a week, once a month. There's no way to know, but they occasionally include animal products. But if someone calls themselves flexitarian, then you should know that they meeting eat is not a daily basis. They're not eating meat on a daily basis. And low meat eaters, they're similar to semi-vegetarians and flexitarians. They will eat meat every now and then. This is a self-label. It's not really a textbook definition. If someone calls themselves low meat eaters, then it's best to ask how much meat they're eating and how often. In plant-based diets, we don't classify them as vegetarian diets. They are diets with more plants than a traditional diet, I guess. They have a pretty vague definition, but this is still a movement towards vegetarianism. And if someone calls themselves um, if they say that they're following a plant-based diet, we don't assume that they're vegetarian. And we have a vegetarian menu in Medical City Denton, and the foods we don't serve are all the meats, chicken, um, turkey, ham, sausage, pepperoni, and all variations of these. Again, this is a menu appropriate for a lacto-ovo vegetarian. And we have some menu items specific to vegetarian menus, such as grilled tofu, hummus veggie wrap, garden patty, and pesto grilled cheese sandwich. So it is the best thing that you can do to ask to a patient who requests a vegetarian menu what kind of meats they're eating or avoiding. Because the type of meat that they are eating, for example, they may be only eating fish, that may be providing the highest quality of protein to that patient during their hospital stay. So it's very important to ask and identify and serve them that entree or meal. And vegan, if our patients are vegan, then we will have to pick their meals manually. And their breakfast could be Belgian waffle or cereal. And lunch and dinner entrees have to be one of our vegetarian entrees. For example, vegetable lasagna, veggie quesadilla, or grilled tofu, or hummus veggie wrap, black bean burger, or veggie pizza. And the sides are going to be steamed vegetables, vegetable soup, side dinner salad, or a fruit cup. Still a pretty balanced menu. And that will be all for me today. Thank you so much, and try to take the post test. Link will be under the video. Thanks.